Sure. So as a brief background, what we saw from the phase 3 VISION trial is that lutetium PSMA-617 prolonged overall survival in patients that had metastatic castration-resistant prostate cancer who had previously progressed on taxane-based chemotherapy and androgen receptor signaling inhibitors. And so the aim of our study was to evaluate the efficacy and the safety profile of this therapy within the expanded access program and to compare the results with those from the VISION trial. And the expanded access program was open to provide access to lutetium PSMA-617 for eligible patients until FDA approval was obtained in 2022. And so what we found in general is that patients with mCRPC who were treated with lutetium PSMA-617 under the EAP were more heavily pretreated with androgen receptor signaling inhibitors and similarly pretreated with taxane-based chemotherapy. And they also had higher baseline ECOG scores and a higher prevalence of nodal disease on their baseline PSMA PET. Overall, patients enrolled in the expanded access program experienced a similar overall survival, as well as similar PSA response rates, demonstrating that this therapy has a favorable efficacy and safety profile in heavily pretreated late-stage mCRPC patients. So what we found in our study is that patients in the expanded access program generally experience higher rates of all-grade hematologic toxicity compared with VISION patients. However, high-grade hematologic toxicity, so grade 3 or 4 hematologic toxicity, was actually similar in general between the two cohorts. And this was an anticipated result because patients in the expanded access program were similarly pretreated with taxane-based chemotherapy, and they also had similar rates of M1b or bone disease on their baseline PSMA PET. Both of which have been previously shown to be associated with the development of clinically significant hematologic toxicity in this patient population. Bone tumor volume on baseline PSMA PET has also previously been demonstrated to be a risk factor for high-grade hematologic toxicity in this patient population, and it may play a role in identifying patients that are more susceptible to developing clinically significant myelosuppression. So what we found in our study is that EAP patients had higher baseline ECOG, they were more heavily pretreated with ARSIs, and they had higher rates of nodal disease in their baseline PSMA PET. And taken together, these findings suggest that these patients were later in their disease trajectory compared with VISION trial patients. And while EAP patients did have higher baseline PSA levels compared with VISION trial patients, we were not able to assess whether those differences were statistically significant because it was a continuous variable. But in our study, we observed that EAP patients had similar outcomes to VISION patients in terms of overall survival and PSA response rates, suggesting that this therapy still demonstrates an acceptable efficacy and safety profile in mCRPC patients outside the structure of a clinical trial. In terms of strategies that could potentially improve outcomes for these patients, there are a variety of clinical trials that have looked into this. There was recently a study that was published that demonstrated that extended therapy with lutetium PSMA in patients who received more than 6 cycles of therapy also had a favorable efficacy and safety profile and may be an acceptable option for patients who demonstrate an initial response after 6 cycles, although these findings need to be validated in larger prospective trials. So lutetium PSMA-617 is currently approved for mCRPC patients who were previously treated with androgen receptor signaling inhibitors or taxane-based chemotherapy. And results from the therapy trial done in Australia demonstrated it achieved similar overall survival and improved PSA response rates and fewer grade 3 or 4 adverse events compared with cabazitaxel, which established this therapy as a viable alternative to chemotherapy in the castration-resistant setting. Prior studies have shown that quantitative parameters on baseline PSMA PET-CT may be useful for identifying patients that are most likely to respond to lutetium PSMA. So higher baseline SUV mean, for example, on baseline PSMA PET has previously been shown to be associated with higher absorbed doses of lutetium PSMA and was recently associated with improved outcomes based on a sub-study of the VISION trial. And analyses from the therapy trial have also shown that PSMA SUV mean on baseline PSMA PET was prognostic but not predictive of overall survival.